needs research and innovation for universal health coverage. That is the big thing. It is so big that I can't narrow it down in 10 minutes or 20 minutes and say I'm going to give you everything. I'm going to talk something about these things that were given to me, but also highlight a few of the areas where we can have our focus. Next slide. So when I was looking at the sub-themes, I was like, okay, foster the impact of innovation, the role of research in healthcare. So one of the things that came up to me was evidence-based practice. And I mentioned that one of the things that I want to see, if I can be able to detect, for instance, bladder cancer in urine, prostate cancer in urine. And once I have quantified and specified that modality, then I can be able to stand up and say, now in our setting, we can detect cancer in the communities in our population area using urine. And maybe we should catch it up early. Because at the UCI, majority of the people come when they are in stage 3 or 4. And in that stage, if we can treat, we do palliative management. So, guiding treatment protocols, again, this comes to innovations. As what I was saying, he's making some things that I didn't even put in the head. But he talked about 5 things he's making. I don't know where they are drugs, I don't know where they are formulations. But those formulations, whatever they are, they're going to guide us in treatment protocols. In our setting, we try to see if we do purpose medicines for treating particular cancer. Outside this, the protocols are already established. And because we repurpose, we can be able to guide the treatment. The other thing, improving patients' outcome. As I said that most of the patients that come to the UCI, for instance, they come when it's stage 3 or 4. And the purpose of treatment is most times palliative care and not treatment for cure. But if we're able to do an innovation and make an intervention in this people's lives, are we likely to improve the outcome? Are we likely to transfer them in their stage 3 or 4 to cure? And be able to say, in our ways of doing things, in our ways of utilizing our new knowledge, our new ways of thinking, we are now improving our stage 3 or 4 from palliation to cure. Then I also looked at influencing police and health systems. I'm happy that Dr. Mark is around. Once I come up with an innovation, we shall tell her that this is what we're doing. Then she's going to take it to another level in committees and then to the ministry and be able to change policy. Next slide. What innovation in healthcare? Again, I was thinking, what innovation do we have in healthcare? New approaches to care delivery, technology products and processes. Technology products and processes, I'm talking about detection of cancer using urine, which is not there, which is not documented anywhere. If we use that using our knowledge to research, it's going to be a new innovation. Then, technology. We know that every other day, technology is improving. Now we have AI. Can we be able to utilize AI to be able to detect the diseases in our cities? Because as Nura is saying, in our village, we have come from our parents, our friends, our contemporaries, or our doctors, or whatever we are. We therefore, those that can call us to be using the knowledge that we have. New approaches to care delivery. Can we be able to deliver in Rwanda now? They can deliver blood using drones to rural areas where vehicles couldn't reach. It's an innovation. Can KIU or this organization that's gathered here, Imperial University, Full University, Muslim University, come up with an innovation of delivering medicines to somebody who is in the village, and then know that this medicine is appropriately taken. Those are the things we're looking at care delivery, at technology, and then the products. We may not make new medicine, but can we repurpose the one that we have? It has been here for many years. Can we repurpose it for a new disease or for an existing disease? But what is not made? What is not made for? I made that small formula that innovation equal to new plus usefulness plus scale. If you have an innovation, which is a new thing, can you make it of good use? But once you know that it has worked, can you expand the scope of use? That's why we call it scalable. And the purpose of this symposium is all about that formula. You may forget everything, but make sure that you go with that formula. Innovation equal new plus usefulness plus scale. Whichever innovation you are thinking about, can it be a new technique? Can we use it universally? Can we expand it in the scope where it's supposed to work? And I gave a big example, telemedicine. Now in cancer, we don't necessarily need to have a tissue block at the UCI where we have the pathology, but we can have it done in machine. We use a microscope machine that connected to a camera and be able to read it and make the analysis in Kampala. And then the patient will transfer it either here or to Barara or to Uganda. It's something that we expand the scope and use. I already mentioned that. Almost we roll out. Again, I'm happy that Dr. Mark is here. They're the one who saw the innovation for formulation of oral morphine. When you're in the cancer issue and handle, you need to think something very simple. But it started with, I think, they broadened it, they packaged it, they leveled it, they studied it. It's just written about 6 or 8 years ago that we came to the stability to give it a good show. That's a new innovation in our city. So, can we contribute thinking? I know that there's the part where we say, how do we start thinking? I'll come there. I'll come to that later. Next slide. Research innovation is a cycle. It revolves. But that cycle, because it goes in a revolution, you begin with a problem identification. What is the problem? Then you go to research and discovery. Can I do something about this problem? Then you go to translation to application. Once you have known something, can you apply it in a setting? Then you look at innovation and implementation. Once you have said you have done it in the lab, can you step further and have a product that you can test? Dr. Ness was talking about having patents. Once you have tested it and then you have come up with a name, can you then gazette that name to be you as an innovator? Then can we evaluate it? Does it give us accuracy? Does it give us specifics? Then we can scale it up. Once we have scaled it, once we have known that does give us specifics, then scaling it up means that it's acceptable, but register it and put it in our community for setting. Next slide. In the balance of research and innovation, those are the things we are looking at. I know you are asking, what? How, if you have an idea, how do you begin to think? I told you that you can put your idea there and they say, no, it doesn't qualify. It's okay. It's very, very okay. It won't qualify the first time. It may not qualify the second time. It may not qualify the third time. Continue putting in ideas. You never know. The 10th time, the 100th time. It's the one only innovation that's going to qualify. I will never forget a speech done by Professor Noah in the Department of Public Health. He said he wrote 100 proposals. 100. None of them have been awarded a grant. It's only the 105 ideas with the vaccines that made a change. And then a few years down the road, they say, after all, you can live without the vaccines. But it was an idea of somebody who was very innovative. Next slide. Challenges. I will still say that we have limited funding and infrastructure. I'm happy that the Ministry of Health is here. The ministry, these imperial universities are here. If we can only budget for research and innovation as an independent budget, and then we will task the students that whoever comes up with an innovative idea, the man is here, he uses it. At the Council School of Studies, that is with the Department of Research, we give 20 million to any new innovation in the first quarter, and 50 million in the second quarter, if the innovation can be built up to the next quarter, and 120 million to the third quarter, if we know that we can lead to a product that can solve a problem, and 500 million if a problem can be scaled up. You have started as cancer institute. I know that the university has that opportunity to give you money to build up your ideas and come up with a solution. Regulatory bottlenecks. Yes, those are there, but you see, the advantage is that we have known how to overcome them. Just come up with the idea, come up with the product, check it is not regulatory framework. One of the things that I must say is that President National Drug Authority welcomes innovation from their very own. Do not stop thinking, come up with innovation, shall take it another level. Brain drain. I'm happy I mentioned about it. I told you I just came from Germany about 2 weeks ago. It wasn't just a get somebody who loves your idea, who has the money, who will take you out from here within a minute. And I mean, you look at it, you see where you are living, you see how you are living, you look at the money and say, why not? The next minute you're on the plane and you never come. We can do better if we involve people who mentors, who teach us, to develop solutions for our population. Resistance to change. Now, this is what we got even during COVID. I mean, that's what I was talking about COVID-19. I wasn't here when COVID was around, but I would read in between lines the innovator of COVID-19. He was bashed left and right. At one point, I thought he must have thought that he did a mistake to bring out COVID-19. But he never, he's also a man who never gives up. We should be able to accept the new idea, the new innovations. And changes are always good. They're not always bad. You may not run for them immediately, but cope them, accept them, and move forward. Digital translation of research to practice. All universities, at least now I'm happy about, all universities have got translation labs. Let's have this idea to work in the lab, use the lab, yes. Whatever it is, let's develop it and move it on until when we have a product level and we know this is our own innovation. I'll be glad in our sixth symposium if we have innovations, qualities that are formulated by us in our labs, but giving them to people who have attended symposium. Next. So what is the way forward that I think about? Prioritizing health research funding, and I mentioned it. All universities should prioritize funding for health. So if you can put their money, each university put their money and say, whichever student has a good idea, money is here for you to develop your idea into a product that you can put on the market. Create innovation hubs in health institutions. This started with Makerere last week on Tuesday. The president was in Makerere to seek for himself the ideas from students. What new innovation they have? What can they change? And I'm certain that in the next coming budget, the hubs, which the vice chancellor has also mentioned about the hubs that we have in universities, are going to get extra funding from Ministry of Education, from Ministry of Health, overcome the challenges that we have in here. Foster public and private partnership. Why not? If you have an idea and you think you can develop it, look for a rich man elsewhere. And let him give you the money to develop it. That rich man will make your name shine more. Do not give him the party, but let him be your collaborator. And you share the profits. You should learn where the money is and so on. Encourage implementation science. When I was an undergraduate, I used to love to read things for the sake of us. And when I started my master's, my college, I learned that that's not good enough. And that's when I realized, most especially when I was in that college, that everything I learned matters. When I was doing clinical cases, they would take me back to my physiology of first year medical school, cells and tissues, body fluids. And I thought I finished, I left it there and I passed. But that's what it is. When you're dealing with clinical practice, those are the basic things that you have to know. When you see the results from the lab and you see the sodiums are low, the potassiums are low, or the sodiums are high, the potassiums are high, as a pharmacist, what do you conclude about this patient? Could it be renal failure? Could it be dehydration? Could it be a virus somewhere? What would it be? It's very important that we get implementation science. And whatever we learn, we put emphasis on each and everything we learn because it will help you reach somewhere. Next. Next slide. How do we make creative thinking for us to be innovative? Trying innovation and problem solving. Once we have known of an idea and we put them in a group, let's not just say, I've tried it out and keep quiet. But try to develop it further. Look at the end results. You may not see the end results, but look at the end results. Use the end results to make you think and think more. Encourage new perspectives. If you share an idea to another person says, but I think the way you're thinking about it is not the right way. You know, I think you take it this way. Please welcome that idea and note it down. By the way, each new idea, don't just say it, write it down. And wherever you meet first idea. And write whichever comments people make. Because those comments are going to make you build it better. Do not discuss and when we're just there talking without writing down. Because you will forget. Our brains are full of so many other things. You will forget. Write it down and please refer to it. Enhance team performance and morale. Do not shower down anyone's idea. Even when you think somebody tried it and failed, encourage them to move on. And if anything, if you have somebody who has done it better, tell them, yeah, but go and ask somebody who did it better. But this is now people who want to look at the natural medicine. And as is here, just get his number, call him. I'm sure he's not a miniman not to receive your call. Or text. I'm sure he's a very good man to reply on this. Send him an email. Put your idea down. The way you think about it, do not shy away from it to beg. There's no big idea inside. Just put it there. You correct it, but at least when you share the idea. Me, I feel honored and happy that you have resources. Dr. Chan here is, he calls me his mentor, but I call him my mentor. Because he has many ideas. He does many things. I even don't know why he gets the time to do them. Essential in research and healthcare innovation. That is why we should put our focus because we are going to work. Let's get focused on research. There are things that are difficult, that require a lot of money. Let's begin with what we have, the basic one. What we should always aim at, generating new, original, and useful ideas. They must be new. They must be original. No one should have done it. Why do you want people of innovating soap or detergent? Like now we're looking for brands of different detergents. We're taking them from solid to powder to liquid, so it will be paper. So if that one can be a new idea, just look for new ideas. They should be original and they should be useful. But this requires safe, collaborative, and open-minded environment. That's what I told you. That do not shower down anyone. Help them to build their ideas further. Because when you shower them, sometimes, especially if we say, a lady is sharing an idea with a gentleman and the gentleman showers it down, the lady may never ask that thing to any other way. And the other way around, if the prospect is yours. But for me, what I think, that you should be able to identify people who will support you and build you up. They are haters in everything. Don't forget that. You could have maybe on a bad day woken up on the side, wrong side of the hater, and you share the idea and the shower it down. Look for another person who will welcome you and then build your idea better. Who will not stop sharing ideas, who will not stop thinking. Let's innovate because problems of health are not ending, they're just beginning. Next slide. The method is also stimulative thinking. I put a number of them here and many others down, but one of the things is brainstorming. When there's no lecture, when you're on a holiday, when you're going for lunch, you brainstorm. Just talk about anything, but pick out the key things from anything. There is a saying that we talk so much about anything and about nothing. Now, in that nothing, pick out something. In brainstorming, encourage quantity over quantity. And no judgment during idea generation. No one should judge you wrong, but appreciate somebody's idea and build it on. You build on one another's ideas. All these innovations that we see, the phones we are carrying in our hands, these lights we are seeing, these microphones we are using, it was an idea that was generated by one community and was shared around. Fostering creative culture, encourage curiosity and experimentation. If in the lab and you think you can add 1 to 2 and produce 10, add 3. Go ahead and do it. But also ask, can I add 1 to 2 and produce 2? I don't know how to do it. Then find out if you can understand that. Let's do that. That's what we call innovation. Celebrate small wins and new ideas. Whatever somebody has come up with and has been awarded, they celebrate them. It's what is celebrating everything. Offer autonomous thought. Offer autonomy with purpose. Sometimes we don't give purpose to the things that we do. But it's important to give autonomy and purpose to the things we do because those are the ideas that will build us to another level. Next. scammer and design thinking. Now, mind mapping is what I told you, writing it down. Writing it down. And go back to it on your own. And ask yourself, but when you thought about this, when you said this, what was he thinking? Design thinking, empathy, ideation, and prototyping. You say lecture that sounds so when it's giving you an idea, this is how it seems. Follow that. Some of us are who we are because of the people who taught us or the people we met in our lives. You should learn that, and that's how we should generate ideas. Next. Now the question is, a lot of people funding for research, and so if you go to a Minister of Finance and ask you why fund research, drive innovation. Back to where we started. Money will drive innovation. And I'm telling you that, for instance, if our universities put their money and say, you have an idea, here is money, you see how many ideas students produce. Second, millions to utilize best policies and practices. This is very obvious. Build scientific and clinical capacity. Now, once we have got these innovations, save lives and improve public health outcomes. When we have got these innovations and we have put them out there, everyone will want to come and shower. Everyone will have to be a pharmacist. I can tell you that the pharmacy profession is a noble profession. And because it's a noble profession, it's full of ideation. Bring those ideations to the table and put them in purpose. Next. So, impact of well-funded researches. And I quote a few examples. Cancer survival improvement. For me, that's why I belong. If we can do simple things within our setting that can take us cancer early, and we initiate treatment with these patients, there will be improvement of their quality of life, and they will live longer lives. So that COVID vaccination worked as a global case study. I mean, sometimes some brands of COVID was generated from a family, a husband and a wife. These are things we are talking about dinner table, and come up to they are billionaires at today. Think, bring out ideas in a positive sense. Cost-effective innovation like oromorphic, this one I mentioned it before, and local studies that influence national policies. And that's why I want local ideas produced in this symposium. They are the ones who are where the solution for health problems lie. Don't read books, those big books, those were written by the ideas of the Europeans, local ideas. For me, that's why I don't throw away people who give today to pregnant women. The thing that I can do as a pharmacist is find out what is the composition of clay. Then I formulate clay into a good formulation. And then I will say, and a pregnant woman, here's the formulation for you. From the clay, right? Next. And finally, and what are the missed opportunities? So this is the message that I'm telling to our universities, our policymakers, and limited local data for health policies. We cannot know how much we have because we are not funded. We need to get money and find out how much we have in terms of resources. Delay treatment and advancement. Now people are dying in villages there because they are looking at treating hospitals. These hospitals are far. Sometimes people there is hard. But if we get a solution, simple solution for simple ailments in their local communities, we're going to have a thriving population. Brain, that one I mentioned it. Whatever there is money as well. I mean, after I've studied all these years, we might want to do something for money. Why children who look after children's rivers? Why would a nurse move all the way from Kampala to come here? And wait, they call it that you didn't give soap. Reliance on external solutions, not tailored for all. You see, the problem of getting money from external funders with us to the achievements. But if we generate money in our settings and ideas within our settings, we are going to live a better life, but also going to solve local problems that are the major setbacks for growth of our population. Next. Again, why investment leads to breakthroughs in health? Accelerate drug discovery. The example I'm mentioning right now is COVID. I know there are so many others that are there that I can't remember. I know Dr. Simon would have his own formulation that hasn't put on the table, but I know he has it. Because he's thinking every day and night. And then was Support clinical trials. This can be within our government, within our population, promote innovation, delivery, and strengthen local and contextual research. Local and contextual. We do research looking at our population. We can do much more using our local knowledge and ideas. Next. I gave a lot of stages of translation research. Could be for future use and look at it for the future. But we begin with basic research, clinical research, and clinical implementation. Next. I give examples of translational research in our health, and the commonest is HPV vaccine. It's very key in our setting. Oral morphine, palliative care in Uganda, malaria test. Ibrahim University, I think the other year, 2 years ago, they had a kit for rapid testing of malaria. HIV treatment guidelines started in Uganda. Local ideas in the local context. Next. The values of partnership. So this is very key. That's why I say we should know who to partner with. Accelerating research, bridges gap between discovery, enhance funding and resource sharing, builds capacity and talent, informs health policy, and improves outcomes. Next. So the role of regulatory bodies, again, that's why I come to the National Drug Authority, to ensure acceptability and efficacy. We don't have a new idea about promoting medicine. We should look at its safety before it begins to operate. Accelerates approvals. I am so happy that this stage, if I go with my innovation to the National Drug Authority, it won't take the endless days. Take the shortest time to be approved, and I'll be able to put it on the market very soon. Supporting clinical research. This one I mentioned. Providing clear regulatory guidance, partnering with academia and industry, that's where we're here, monitoring and post-market surveillance. Next. Ways of stimulating regulatory ways, there are quite many and they're documented. Next. I think that was my last slide. I thank you for listening. I have talked a lot. After I mentioned this about what I do, because it would be boring to most of you, but I welcome questions after this presentation. Thank you very much.
I think he deserves much better than that. Thank you so much, Mr. Joe. I told you, wasn't I right? He's a well of knowledge, and I am, for people like him, I am more than grateful. I'm usually more than grateful. He's very passionate about the next generation of pharmacists and health workers in general, and that's why he will travel at his own cost, by the way. His own cost. OPSA is not paying for his transport. They've not paid for his time here. He would have had many other things to do that would, add him a bit of money. But he's here, and I don't want us to take that for granted. Make it a point that this symposium, you learn something from it. Make it a point that that is a takeaway, one or two things at least, guys, that you take away that will change you and ultimately change the face of healthcare in Uganda and beyond. I hope that the presentations you're having today are really meaningful to you, and I hope that they are impactful to us. Thank you, Dr. Messenger. I'd like to invite Atwine Kato Christopher. This is a students' symposium, and I feel that you should take charge. Where is Atwine? He's the moderator here, according to our program. Is he around? Atwine? He's not around. Yeah, can we have someone from Kenya? Where are our Kenyan guests? Rwanda, President Sanu. Yes, he's from Kenya. Yeah, I want us to participate more in this, please. Please come. Yeah. Thank you. You can introduce yourself to the audience and take questions for the presenter who has just made a presentation. Please feel free for our international guests. This is home now. And as I call upon the abstract presenters, it's very appropriate for the minister to know the ideas that you have. Sometimes we underestimate the potential that you have. We want the minister to hear from you so that she can support you in one way or another. Thank you.
Thank you. Morning. Morning. I'm saying morning because you are not going to lunch. So, good afternoon. So, my name is Emmanuel Pizera. I come from Uganda, and also I'm the president of the Uganda Pharmaceutical Association. So, thank you, Doctor, for this discussion, for this presentation you gave us. So, it's really very interesting. It's really very amazing and insightful for us as future pharmacists. So, we thank you. So, let us take a question.
So, yes, Dr. Benjamin, thank you so much. My name is Charles Daniel from KIU, and I would like to ask you a small question. That was really inspirational and encouraging and motivating for us to know that UCI has some funds available for research. It's really a milestone. Now, my question is, most of the students here from KIU, from MAST, from Makerere, from Rwanda, some of them have done some products which are actually a bit innovative. Actually, they're innovative. But then, how best can they be supported so that these products can actually hit the market? I know there are steps they have to go through. You already mentioned the challenge of funding. Yes, it's there. But then how can we stimulate them? Because at all these symposium, even if you move outside the tent, you'll see products all over there. But the costs of production, many times these guys never break even. And I feel if they were supported much better, perhaps they would get further. This question is for you and our minister, the commissioner, Dr. Matha. Thank you so much.
Okay, thank you. Yeah, another question.
Thank you so much, Doctor, for your marvelous presentation. My name is Pope John Paul II from Uganda University. Your presentation is touch all of us in the house. We know cancer doesn't segregate, whether you're young or old, whether you're rich or poor, educated or uneducated. So, my question to you, Doctor, are there some breakthrough in the research industry at the moment on new treatment protocols targeting various cancers we are having in the country? Thank you so much.
Thank you. Dr. Meyo, I want us to take more question.
Yeah, let me answer the one which Dr. Shan asked. Yeah, so how do I support? From my perspective as a cancer institute, if we have an innovation targeting cancer, send me the protocol and do validation. Once I've done validation, send me the money. Then I approach. What new researches are on the new molecules, the most specific therapies. So what we are saying to the manufacturers when they come to Uganda to ask, but these studies were done in the population which is not Africa. Let me take you a step backwards. I was giving a talk at the Symposium at Cologne University in Germany about 10 days ago. And I was showing them the diversity of presentation of some cancers in Uganda. And I was assuring them that near time of treatment, we cannot treat our population because of genetic diversity in our population. And they all agree. So going forward. Whoever comes with a new diverse because then our African genes, they are too diverse from the other genes of other populations elsewhere. This you may not have known, but you must have read. That's why when it came to COVID, we are not as affected as the parents and nations. And everyone asks why. We had very poor health systems, we have very poor health behavior, but we survive longer and better. And we still survive. We believe it's our genetic diversity. So whoever comes with the new innovation, the new knowledge from the Western world, we encourage them to do clinical trials on our population and give us the findings before we can give up. So that's the way we're handling it, and it's working for us. It is still very difficult to start this. We are only beginning with 2 molecules at the cancer suit this year. In cancer, I know that TB has started also, and malaria is also doing their part. We're going to diverse all these things, even those new molecules, antibiotics and others. It's the only way we can have proof that those molecules work for our population.
Thank you, Doctor. May I take one more question?
Thank you so much. Good afternoon, everyone. My name is Moses, and the question is, how can local research capacity and infrastructure be strengthened to generate relevant and high-quality evidence that can guide implementation and also the universal health coverage efforts?
If you follow me in my presentation, I said if we get support from our institutions by putting the resources together, universities, hospitals, Ministry of Health, National Drug Authority, local governments, that's one. If we can have collaboration with people who have money, since we don't have the money, get an idea and look for somebody who has an idea where they can support you. In our setting, we have people whom we call rich, but we normally call rich because maybe they drive big cars, build big houses. In the Western world, rich people have money that they share out to people. So if we have rich communities, we send the idea to them that look, we have this idea. Can you give us the money and go to further? That's why when I say we are rich, I say we are not rich. All of us are poor in this country. It's not rich person. Because no one can give you free money for such innovation. But if you can entice them, those ones that you are close to, and these they are building schools, can we entice them now that they are doing schools, put some money in research? That would be another way where we can access money. The other, in materials I told you on Tuesday, the president opened up the SARS week. There is a SARS hub within universities, in a universal collaboration, putting money for research together. Because it is a directive of the president, that means a law for universities to have a research hub. It's not just a hub as a room, it is money with people, with ideas. That will put us on our way. So these ideas, I mentioned them in my presentations. I may not have highlighted them, but those ideas that I think we could really grow to get money and build research hubs and make new changes in health for our country. Thank you.
Okay, thank you, Doctor, for your insightful. So, hope everyone here are going to start research. So, we are ready to welcome the Dr. Antoine for continuing the panel narration. Thank you.
I may not have highlighted them, but those ideas that I think really get money and build research hubs and make new changes.
Disclaimer.
Yeah. Thank you.
Okay, thank you, Doctor, for insightful. So, hope everyone here are going to start research.
Presentations.
We are ready to welcome the Dr. Antoine for continuing the panel narration. Thank you.